Last month, members from various industries throughout the IAM gathered at the William W. Winpisinger Center for the Safety and Health Conference.
This conference has been remarkable. I mean, I don't know if I could compare it to any other conference that I've been to.
This isn't your typical conference. The schedule was packed with interactive safety training, critical in today's climate.
We're part of the AFL-CIO Safety and Health Committee, so we look at all the unions. We meet on a regular basis. What are we seeing across the board in all types of workplaces? So we look at some of the trends on that. We look at some data from OSHA. We've surveyed our members to find out what exactly they need.
Students started off the week with a 10-hour OSHA training, covering the basics of workplace safety, including how to identify and report potential hazards.
Really what we're doing is we're empowering our safety committees to take the next step. So when they go back to their workplace, they can look at different hazards. Is there an electrical hazard? Is there a walking working surface hazard? Or things that may be lacking in the workplace, and especially after COVID, there's been a lot of change and everybody's kind of lost track on the way things should be. So this kind of gives them the opportunity to look around and say, okay, hey, there's a hazard here. Let's eliminate this hazard.
Next up was CPR and First Aid Training. The hands-on course taught them how to administer CPR and use an automated external defibrillator, also known as an AED machine.
Press pads firmly on skin.
A lot of the members that are here this week are in the airline industry, so they have a lot of contact with customers. You know what I mean? Young, old, anybody could go down at any point in time. Just maybe having a little bit of confidence to be able to jump in and help somebody out that's having a cardiac issue, save somebody's life.
All clear?
Personal life and at the airport. I've had to call 911 because someone passed out, heat exhaustion. Anything can happen when you're in such an intense working environment, and it just helps to have a few people that are just well trained on what to do so that maybe we even notice signs before it even gets to that point.
But sometimes there are no signs, especially in an active shooter situation. So knowing what to do can be critical to survival. Like if someone had life-threatening bleeding, how to pack a wound or use a tourniquet. They also practice how to disarm and take a shooter down.
The active shooter exercise was definitely something that I'll never forget. Grabbing the weapon and putting the shooter on the ground and taking control of the situation.
It's very intense because we watched a lot of live footage. I think that having the proper training, even if you panic at first, you are prepared. You have your moment of panic, and then your training kicks in, second nature, so you can better handle a situation than if you had absolutely no training and are just operating out of fear.
They also learn what to do in case of an opioid overdose and how to administer naloxone. By the end of the week, members walked away with a 10-hour OSHA Authorization Card, a CPR and First Aid certification, and a fortune of knowledge to help keep their workplaces safe.
It's seeing adults that are passionate to be here and engaged in participating in the learning process, not just sitting here because they got to be here. They're here because they want to be here, and they're interacting with the facilitators and each other. It's just a great all-around environment to be in.